I'm Mary Pipino, and welcome to Fit for You, the show that teaches you how to live a healthier and more fit lifestyle. Today we have a very interesting show that if you're a woman, you're going to want to watch, because we're going to talk about hormonal health and why our hormones do all those crazy things in our body. And if you're a gentleman, you're going to want to watch because you're going to want to understand the female psyche a little bit better and why hormones affect us like they do. So I hope you enjoy the show. Dr. Dean Economus, one of the foremost OBGYN physicians in our area, will be joining me. And I think we're going to have some interesting things to chat about. Thanks for watching. I'm very happy to introduce one of the finest OBGYN doctors in our area and one of the finest nationally, who we are very lucky to have in our area and who isn't new to the camera, Dr. Dean Economus.
How are you?
Good. Thank you so much for coming.
Thank you for having me, Mary.
Board certified OBGYN, and but very experienced in chatting and taking time with your patients and really understanding women far beyond whatever their particular issue may be at any given point in time, correct?
We try to listen, and that's our job. Sometimes they taught us in medical school, it's what you're not hearing that's as important as anything else. You just listen, and you pay attention, and you observe what you're seeing, and sometimes giving somebody a little bit of time, they'll tell you things that they might not have told you about that they're having problems with, and then you can help them.
I think why your patients love you so much, and it's so important, and when we were preparing, I think one of the things I was most impressed with was you saying, these women, that's their time with me, and I want to give them my full time and my full attention, and I listen.
Right.
And that's so critical.
It is. When we come into my office as a new patient, we go back into my office and have a chat, one-on-one across the desk, and then we go into the exam room and do whatever we have to do. But up at that point, that's your time to get comfortable, to talk, and go over your history and ask any questions you have.
Fantastic. And I know you've done some TV in the past, so this is very easy, very comfortable for you. I
enjoy it. I like informing people, educating people, and that's a big part of what we do.
Great. Let's talk a little bit about hormones, because I find that to be a subject that we so often blame for things, but I don't know if people really understand. And I know even myself, I try to read as much as I can, but I really don't know and understand and often think, what is going on, What is a hormone?
A hormone, they're steroids that your bodies produce. And you produce different amounts at different times in your life. Women have certain kinds of hormones, men have certain kinds of hormones, and we each have a little bit of both. And throughout our lives, they're different at different stages, and they affect us in different ways at different points. And it's just how we handle that.
And I loved your suggestion in our preparation as well. You said, let's talk about it from, and if we're going to focus on women today, let's talk about it from when a girl is like just getting ready to start her period up through people that are into their 70s and 80s, well through, menopause and the various stages of life. So let's start with these young girls. What's going on? I know you told me, girls are starting their menstrual periods at a much younger age. What's happening?
It used to be 10 years, 10 years old was normal-ish. 10, 11, 12 young girls would start, and 8 was considered too early. And now a lot of young girls are starting at 8, and that's not considered unusual at this point. And the thing is, we don't know what's causing that. We don't know if it's just good health and nutrition. We don't know if it's good prenatal care on the mother's standpoint. We don't know if it's the vaccinations that young ladies are getting, early in their lives that are keeping them healthy. There's questions about supplements and steroids in the foods and the milk and the chicken. They say they inject chickens with steroids to give them, larger white meat, the breast part. So there's questions about all those things. And we don't quite know, but it's not unusual to have younger girls starting sooner.
Now, it's not bad that they're starting sooner then?
No, it's not bad. As I said before, 8 used to be considered too early, and that was an issue. 10 was normal, but now that's in the range of normalcy.
Now, would you say that's when the hormones start to really, you start to see the hormones taking a stronger play in our physiology and in our health around that point?
And that's really, that's when the puberty starts. Puberty starting early, and that's when the whole reproductive life of the woman starts at a young age.
And then the mood swings start, the highs and lows. What can young girls, any advice as to what or how things they can be doing to maybe, mitigate some of that?
It's a very difficult time because they're young, and obviously, as we said, younger. And it's hard to understand your emotions, especially when you start, they aren't always regular. Your cycles are all over the place. And that's because the hormones are all over the place. And when things aren't normal, it's hard to predict what's coming up next. I think over time, as I've talked to women, the more and more we discuss things, you realize that even though having a little monthly cycle isn't the favorite part of your life, but the predictability, the regularity, all those things are important. But when things are out of whack, it's difficult. And so the key is to promote regularity or keep track of that and see how things go.
When do you think a mother or a parent, I shouldn't necessarily a mother, but a parent should be talking to their daughters about this?
Everybody has to gear it towards their child. See what's going on with their child, see what their issues are. And and as a mother, mothers have gone through it, and that's kind of their time in life to go through it again with their daughter and help them through that time frame. I get a lot of questions from the moms. When do you need me to bring them in to see you? And that's a really tough question. Back in the past, they used to come in young, and we would do a checkup and all of those things. Now the recommendations have changed a little bit. You don't have to come in so young. They recommend, the American College of OB/GYN recommends a first visit around 14 or 15 years of old, just for a discussion, just for a conversation. How are things going? Any problems? And then to start the question and the discussion about the Gardasil cervical cancer vaccination that is recommended for young ladies. So that's a good time to come in just to have a conversation. We don't need to start doing checkups or examinations until age 21 for routine problems, unless there's any big issues sooner, and then we would evaluate them sooner.
What about, the discomfort? Or is 8, 9 too young to start taking some over-the-counter medications, and how are they okay for you?
Sure, mild over-the-counter medications, and obviously read the labels and take them as they are. Some of them, they don't have doses for that young. That's the problem. They don't have dosing for 8, 9, and 10. But talk to your doctor, talk to your pediatrician. They'll help you get the correct dosing based on the patient's weight.
Something that is very, I cannot believe how prevalent it is I've talked to different people. PCOS, I want to make sure I pronounce it correctly. Tell us what that is, and I know a lot of people suffer with it, so to speak.
It's polycystic ovarian syndrome, and that's something we're picking up at a young age because young ladies are in tune, moms are in tune, moms have been diagnosed with it, they're seeing signs in their daughters at a younger age, and they're bringing them in to talk about it. They'll often come to me because they have the symptoms.
Now, what are the symptoms?
The symptoms are irregular periods, acne, oily skin, and in some older young ladies, unusual male pattern type hair growth.
And I know, because I know a lot of girls suffer from the facial hair as a result of PCOS. Why? What's happening?
There's more male hormone relative to female hormone in the body. Their bodies are converting their female hormones to the male hormones, and that's what causes those male pattern hair growth. I tell families you have to pay attention because we have a lot of Eastern Europeans in our area, and sometimes that's normal. It's a familial thing as well, but sometimes a polycystic ovary thing runs in their family as well. So we have to weigh that versus what their symptoms are and do some testing if needed.
Now, when you say familial, and I think of genetic, not the same thing, correct?
Correct. There's not necessarily a gene for that, but moms and daughters are built alike, grandmas, and they're all built alike. And the first signs of polycystic ovary syndrome, along with those irregular cycles, it tends to be a little weight gain and those types of things. So, you can see that that runs in families. People are built the same, look the same, eat the same, have the same lifestyle.
What do you recommend for when you have the issue?
The first thing to talk about is what's going on. What's your biggest problem? Are you having irregular cycles? Are you having acne problems? Those can be signs and symptoms of just irregularity and just acne either. But we often will test them, check some hormone levels, and if their hormones are out of whack, if the ratio of their hormones is out of whack, then we discuss treatment problems. And treatment issues. Treatment is very simple. If your cycles are irregular, we can regulate those with usually hormones. And then
Now, that would be
helps
something like the pill, correct?
Correct. That's the pill. And then that would help their symptoms as well on the side. Some women don't have cycle problems and just want to fix the symptoms. Like the hair growth, we can treat with some simple medications. And then you can talk about anything else that you go visit your electrologist, your esthetician for waxing, all those types of things.
And I know there's laser today. That's probably a whole nother show. You know, when I was growing up, and you know, of Italian descent, so I was, you know, electrolysis was my buddy for my upper lip. You know, starting around 12. Oh yeah, and it wasn't pretty. But I don't think I had PCOS. I think I just had the Italian gene.
Yeah. Well, and as we said, that's the issue, and you have to talk about what's maybe, like you said, that runs in your family, or what is something that is a medical issue that we could address and help you with in other ways.
What if you find out you can't take the pill?
We have ways to help those symptoms. You know, we talk about, you know, fixing the hair growth, the acne. We can, you know, work with a dermatologist to fix those problems. The irregularity in the cycles can be a little harder thing, but we have some other medications that we have found. Polycystic ovarian syndrome, we do know, is not an issue by itself, except for the irregularity at a younger age, except for later on in life you could have type 2 diabetes, high blood pressure, things like that you're going to want to watch out for. We have found in younger women that we can help regulate their cycles with some medications, and one of them is a diabetic pill, metformin. By using that will help women not only regulate their cycles, but some women who are having problems getting pregnant, which is another issue with the polycystic ovaries, it helps them conceive and ovulate.
And we're going to jump around with diet and exercise, but what was interesting too in our prep, every time we talked about a problem, it always seemed to come back to, but if you have a better diet and you do have physical activity in your lifestyle, it's going to make a big difference with all of these issues.
100%. And with polycystic ovaries, they found even a simple weight loss of 10 to 15 pounds, women will start having more regular cycles and improving their lives that way with simple weight loss and exercise.
What about the, you know, the bloating and the, you know, the anxiety and, like, you know, it's like, for example, days like when you just, you know, you just can't get into a calm mind, you know, you're like antsy, irritated.
That's a tough time. It's PMS
Hormonal.
for women, hormonally mediated, and there's lots of ways to fix that. If you're uncomfortable, crampy, you can take some medications over the counter, non-steroidals, Motrin, Aleve, Advil, ibuprofen. Something hormonal like the pill, like we talked about for reproductive age women, will help regulate those types of issues. The agitation, the frustration, the discomfort, the PMS, the mood swings. We have medications now that are simple that you take only on those days that you need those, because we know your serotonin levels drop during those days, and they're called serotonin reuptake inhibitors that just bring those up, and you can help your moods on those few days of the month.
Now, is serotonin considered part of the hormonal balance, imbalance thing? Because I know there's so much talk about that when it comes to weight loss and overeating and portion control and mood and...
Oh yeah, we know those drop right before your cycle. You know, and if we can keep those up, it helps you get through. Perfect.
I broke it down to girls between 13 to 20, and then my next group is 20 to 35. What's happening in that stage of our life?
Our teenage years, we're just like most teenagers, just trying to get through, get through day to day, get through school, graduate from high school, and our women, young ladies are growing. Their bodies are changing, and it's an important time. It's a difficult time today, I think, because of the attitudes towards sex, and things are a little bit more open than they might have been in the past, and it's creating a lot of other issues for young ladies, because trying to protect themselves from pregnancy, which is a big thing. There's lots of diseases out there. We have frequent conversations about with young ladies, trying to protect them and educate them, because everybody thinks those types of things would never happen to them.
Exactly.
So we spend a lot of time discussing sexually transmitted diseases, as well as pregnancy issues with young ladies now at a younger age than we might have in the past. And then, as we said before, trying to get their cycles regulated, trying to get them healthy. And young people just tend to be more overweight than they used to be. And that creates big issues with that polycystic ovarian syndrome, again, that we discussed.
Well, in prep again, you made a comment about how weight is so important if women are having a problem to conceive, that they're finding that people that lost a significant amount of weight and had tried a lot of other things were having great success. And I think you noted something like between 75, 100 pounds. I mean, it makes a huge difference, correct?
Big difference. I've had the ladies come in just this year. I didn't recognize them, number one, because they had lost so much weight, and number two, they were expecting. And that's what made the difference. They lost 100, 150 pounds, and they conceived on their own.
Why does that extra weight make such a difference?
Well, fat stores estrogen. It creates a hormonal imbalance in our bodies, especially in women. And so your cycles aren't going to be regular, you're not going to be ovulating regularly, and you're therefore not going to necessarily conceive the old-fashioned way.
Oh, you mean if you're excessively overweight, that could impact your menstrual cycles as well? Because I know if you're excessively underweight, and and you get into a lot of the issues where people aren't eating enough, and you get into, even the anorexia and
Correct.
things like that, I know you can definitely stop menstruating. Not a good sign.
There's not enough estrogen. The fat stores the estrogen, and when you're too thin, there's not enough estrogen, and you're not going to cycle.
So it's all about finding the right balance for your body.
A healthy body.
Do you agree probably better to be 10, 15, even 20 pounds overweight than being excessively underweight?
Yeah, it's all about BMI now. The body mass index, your weight, your height, and putting those things together. But you're right. I guess maybe just we're Eastern European too. I know if my grandmother said I looked good, I was a little overweight, and that was always good. But if you keep yourself at a decent weight, BMI around 25 or under, you'll be good.
Do you pay more attention to weight or to percentage of body fat?
Just probably in a day-to-day in the office, just weight, because that's what we're monitoring with people day-to-day. And body fat composition is a hard thing to quantify, and a lot of people have a hard time, obtaining that unless they go to somebody who's experienced in measuring it.
Well, yeah, but you know what I tell people, and tell me if you agree. You sort of know where you are as far as body fat, because when you undress and look in that mirror by yourself, pay attention. I mean, if you feel pretty strong and shapely and so on, there's probably a good chance your body fat's, in relatively good shape.
Listen, with women, it's all about how their genes fit. If their genes fit, they know they're good shape.
Yeah, exactly. You're exactly right.
You know what's normal for you.
Right. And then we have the pear and the apple. Anything we can do about that? Any hormonal differences you find in one body type versus another?
You're predisposed, based on your body shape, and that's what you have to thank your family for. And that's what comes along with you your whole life. And so you are given what you're given, it's just how you deal with it. It is harder for women who carry more of their fat around the middle to lose that. That's very hard to lose. And that's a lifelong struggle for a lot of women. And just as you and I talked about, diet and exercise is what's most important. And something, the recommendations, it used to be 3 days a week, now it's most days a week. You should be out there doing something almost every day of the week.
Diet, let's talk about, fats and proteins and starches, because I think we're starting to see a real reverse now about, we talk about carbohydrates. I like to focus more on the starches because carbohydrates are fruits and vegetables.
Right.
But aren't we seeing a greater influence now on eating more protein and eating the good fats, get them back in the diet, and maybe get the starches out? White flour, not just white flour anymore. Now they're starting to talk about even our wheat flour.
Gluten-free. Everybody wants to eat gluten-free. People are talking about that. And it used to be just eating low-fat was good. Now we understand that the saturated versus unsaturated fats, it's okay to eat some fats, the good trans fats. Those are okay. Other fats, you want to avoid the solid fats, the deep-fried fats. That's important. We're understanding as, our generation, as we've grown up, we've seen this whole thing swing, the protein issue. You see a lot of weightlifters, they're big into protein, but that translates to all of us. That builds our muscle mass. And if we build our muscle mass and we work out and do cardiovascular and a little bit of weight training, our muscles are going to be burning calories for us as we build them up all the time. So it helps with your weight loss as much as anything else.
Why do women, including me, and I love my good food, but it's the toughest things for me it wasn't hard to give up steak. I love bread. I mean, I love sweets, but and I try to keep them in check, and I have my little binge days. But but it seems like women, that's what we want to gravitate to. We want to gravitate to the starches.
Because that's what's good in life. It's what we enjoy. There's nothing better than a great tomato or a great apple, but really, pasta especially
Love.
growing up the way we grew up. It's what we know and what we like. But my grandfather lived in 93, and he always had everything in moderation. A little bit of this, a little bit of that, never too much of anything.
The thing I find different, though, I think in more women than men, why do women, all of us, why do we don't have a saturation point? It's like there are just days where we can just eat and eat and eat, and it's like, okay, we know if you follow the book, we definitely shouldn't be hungry, but and it tastes good, it feels good. It's
Right.
not just emotional eating.
Right.
I mean, it really, your body feels like it needs it.
I think a lot of that is hormonal. I think a lot of that is cycle related. A lot of women will say right before their cycles, when they have the PMS symptoms, they get the munchies.
Yeah.
They can't stop.
Yes.
And I don't want to say there's nothing you can do about it, but that's all part of it. It's just controlling your cycles, controlling your hormone levels. As we said, if your PMS symptoms, if we get stressed out, I'm a stress eater. I say if you find me in the pantry eating chips, I'm probably stressed out. So it's trying to maintain the stress with diet and exercise, and maintaining your hormones, keeping your serotonin levels up and your hormones regular, so your cycles are regular. It's a whole way of life.
Good fats play a big part in keeping our hormone levels more balanced, correct?
Because, as we said, estrogen is stored in fat. If you have enough estrogen in your body, not too much, then that's helpful.
And I'm saying the good fats because, I remember years ago when I just started to get into fitness, the chic thing was no fat.
Correct.
And that didn't work out too well.
Right.
Well, and I want to comment on something else because everyone's so focused on physical appearance. I think when you don't have enough fat in your diet, I think it plays havoc on your skin. You start to wrinkle faster, and I think you're going to look older, at a much younger age. So,
well, as we age, we lose that subcutaneous fat under our skin, and you see that. If we all look closer in the mirror, you see you don't have that plumpness that you had when you were younger, and that's a big part of it. So, there's a healthy level of fat, as you said.
Yep, and that's why I think it's so, like I said, I can't emphasize enough. Eat your good protein and make sure you're getting your good fats in your diet. Let's talk about things you drink. Let's start with, before we get to wine and alcohol, let's start with pop and coffee. And not even decaf if it's not caffeine. Pop. How do you feel about soft drinks?
Well, pop's very artificial. There's a lot of simple sugars, which are good for a quick energy boost, but really not good for you long term. So do we all fall back on that because we could probably grab and go? Sure. But it's probably a better idea to grab some water.
Now, will soft drinks like pops, will they impact like the negative hormone levels? So, I mean, could they be, a catalyst to cause you some problems that, that are going to make you irritable and edgy and so on, a couple hours after?
Sure, from a fat standpoint, think about it. You drink a regular pop, how much sugar is in one of those bottles? How many teaspoons of sugar? 16 teaspoons of sugar in a small bottle.
Isn't that unbelievable?
When you think about it that way, if a lot of women would cut that out, they would lose a significant amount of weight. Just that regular pop.
Yeah, I don't think people think. They think if they drink it, they're not thinking about the caloric content or the impact it's having on their body like they do if they're chewing it.
Right. It's like wine. You drink wine, there's a lot of calories in wine.
Yeah. So what is your recommendation? Because, we hear good things, bad things.
I say if you're going to drink lots of water. We all need a lot of water. Very few of us probably drink enough water throughout the day. So first and foremost, drink water over pops. Even some of the fruit juices, we have to be very careful. You have to read the labels. There's a lot of added sugars in those fruit juices, which makes them taste good. So a lot of people are juicing. They do their own juices. That's great because you get the fiber and you get the benefit of the fruits in there.
And vegetables.
Exactly, and like a V8. You just have to be careful, though. Buying things in the store, make sure you read the labels because there's a lot of added sugar to those types of things, and those cause problems. Diet pop it's a trade-off. You get the pop without the sugar, but there's really not a lot good going on there either.
Coffee.
I tried cutting out caffeine, and it's hard for an obstetrician not to drink caffeine. But caffeine really, it causes people to have heart problems, their hearts beat faster, some agitation, and I don't care what you say, it's a drug.
What's it doing to the hormones in our body?
It could, I don't know about that.
Okay, let's talk about, but it's not necessarily bad then that it's going to throw your hormones out of whack like sugar will.
I can't say. No, you mean you might be sleepless, and then when your circadian rhythms are off, that might cause you to have some, hormones to be out of whack a little bit. But, just from a day-to-day standpoint, I can't say.
Let's talk about when you get into more in the stage of life where I'm at, for example. I've been through menopause, and I'm in my 50s, and
you look great.
Thank you. It's a job, let me tell you. Yeah, my second job.
It's how you do it.
Yeah, absolutely.
You do it well.
But it's almost there are benefits to being where I'm at too. And I think diet and exercise, fortunately, I never had the horrible night sweats or the hot flashes. Very mild, but nothing. I think it was diet and exercise. I don't know what else to attribute it to. What if women that are having these, these horrible hot flashes, and people that are saying in the middle of the night they can wring out their pillow.
Right.
What's going on?
Well, they're tired, they're miserable, they're cranky to begin with. But research has proven exercise reduces hot flashes. Diet and exercise, working off that steam, working off that physical energy, also the stress that goes through those changes and those symptoms, it helps. And then it reduces your hot flashes on top of it.
Why do we see after menopause, maybe during and right after, and why do we see that midsection start to drop, that little muffin top coming? Even people that exercise and eat really well, it's very difficult to get a tight middle. Why?
There's a metabolism change that women go through during the change in life, and if we could explain that, we can solve a lot of problems. I have a lot of women coming to me in their 40s and their early 50s during the time of the perimenopause, and we discuss this. The first thing I do is check your thyroid, because unrecognized thyroid disease at that point in your life is a big problem. If we treat that, a lot of women fix their weight problems. And we like to have a reason to at least blame for that.
And if you don't have a thyroid problem,
then we talk about diet and exercise, and that's what's really important. A lot of people are very busy and don't have time to do all the things that we need to do, want to do, should do to make our life better. But we have to focus on that because it's very hard once you start gaining that weight, and then it's extra hard to take it off.
Is there anything out there that can help you keep, a tighter a tighter body? Granted, diet and exercise, but are there any supplements that, what supplements should we be thinking about? Because we talk, we hear about calcium and calcium with vitamin D and calcium with magnesium and then naturally a multi. And what do you recommend?
Everybody should start with a good multivitamin. Although in this country, a lot of our food is fortified, so we're probably getting enough, but the multivitamin will kick in anything you're not getting. That's a good start. Women before menopause should take calcium at least 1,000 milligrams daily. After menopause, 1,200 milligrams. We also need to add a little bit of vitamin D to that, and unfortunately we don't have a lot of sun around here, so that's not going to help us a little. About 1,000 milligrams of vitamin D daily helps to get that calcium into your bones. So those are the basics that I talk to people about on a day-to-day basis. We used to recommend vitamin E for your heart. We don't love that so much anymore, back in the day, and things evolve over time. Magnesium is also good for helping to get the calcium into your bones as well.
And over the counter,
they're fine.
Just as good. Anytime you recommend taking I take mine at night usually.
Split the dose. You can't take it all at one time. Your body's not going to metabolize it all well. So split the dose in the morning and the evening. A lot of women can't tolerate the calcium. They say it constipates them or it bloats them.
Really?
Some women have problems with that. So there's the chocolate, there's caramel chewables. I say if you can drink 3 glasses of milk, any sort of milk, whole fat, skim milk, that all has the same calcium. And green leafy vegetables, I tell people read the labels, read and add it up, and do that for a week or two and see where you're getting your supplements. And most women do fine with that.
Are you okay with people having whole milk?
Yeah.
Okay.
Yeah. Just know there's fats in that, but most people aren't going to drink a ton of it. If you get a glass or 2 a day, it's good. There's good fat.
Okay. Osteopenia, osteoporosis, especially in this state. And 2 questions. Number 1, what can we be doing when we're younger to maybe prevent it. And then when you get like into me, I'm an interesting candidate because I do all the right things genetically. There is some of that in my family,
Right.
and so I'm osteopenia, but thank God I've been holding for 10 years. I haven't gotten any worse.
That's the important thing. And it's, once again, lifestyle. Diet and exercise. You need to get that calcium in your diet. You need a healthy diet. And then the exercise. But sitting down riding a bike doesn't count. You need weight-bearing exercise, whether that's just standing up and going for a walk because you're carrying the weight of your body, whether it's weight lifting. I tell women, even if you're going for a walk in the neighborhood, get some heavy hands, a couple little weights, and go for a walk. Every little bit helps because the pressure on your bones will continue to keep them remodeling and keep them building and keep them strong.
Now, see, and that's great advice, and I never really, we haven't discussed it. Doing a bike isn't giving you the same weight bearing on your bones. Okay. Now, what about
cardiovascular?
Yes. What about an elliptical?
Elliptical, you're standing, so you're carrying the weight of your body, and you are also giving yourself the weight of the body, so that's beneficial.
Okay.
For your bones, so it gets a little bit of both.
So, and walking is
That's fine. That's
outstanding.
Great. Yeah.
And I tell people, it's never, ever, you're never too old to start. I've seen amazing results with. What is the most important thing, do you think, that for women to do? And we'll start with the younger girls. Let's start with our 8, 10, 12-year-olds, and getting through their teens. Anything in particular they shouldn't do or they absolutely should do?
I think, once again, healthy lifestyle. We are promoting that now. I know with my kids, my wife and I go exercise, and they see us doing that, and they come and do it with us sometimes. We want them to understand that this is just a way of life. So if we can get that ingrained in our kids from a young age, keep them at a healthy weight level, good body mass index for their weight, and talk to your pediatrician about where they are. They're all getting their growth curves plotted every time they go in. Keep that going and maintain that and get them eating healthy. Then obviously drugs and alcohol become issues in younger and younger anymore. So obviously discuss those types of things with your kids just for a good, healthy picture with young kids. And then with young women, as we talked about before, that kind of still feeds into your cycles, and your reproductive health. Good normal cycles, all of having a good lifestyle, eating a good diet, keeping a good shape will help promote good health, which will give you nice regular cycles, which then gets you to the next stage in your life, which is your reproductive ages. And then your life will be easier then.
Do you find success with hormone therapy after menopause?
It's a controversial area. Because over 10 years ago, the Women's Health Initiative came out, and it said that there's a slight increased risk of breast cancer for women who take hormone replacement therapy. So at that point, the recommendation was to take everybody off hormones. And it's not our first line treatment. Our moms, our grandmas, they were all on hormones first line. That's what they all took. And now we don't use that as much. And so over time, the science of menopause, if you'll call it that, has evolved. And we understand that there are ways to help women get through these difficult times that may not have the risk factors that the hormones had. Not that we don't use them still, but we're supposed to try to use other medications first. And then as a last resort, if somebody's miserable and they can't eat, sleep, live their life, then, we consider that. But it's still recommended, if you do use them, lowest possible dose for the shortest amount of time.
Have you seen people that you could wean off of medication if they can get onto a better, diet and exercise program?
100%. I've seen women, as we talked about before, unable to get pregnant. They lost a lot of weight. Their cycles got regular. They ovulated and they conceived. I've seen women at older ages. Fat can be a problem. The estrogen in your body, especially in the menopause, can cause women to have endometrial cancer. Those types of things are harmful. We don't want you to get those things. So if you stay at a more lean, regular body mass index, then that is helpful to you long term too.
Do you think it's beneficial? I'm a big fan of keeping, a food diary.
100%.
When you're having issues or whatever. And think about what you ate today is going to affect you tomorrow. I like to give it 24 hours. So if you're logging what you're eating and then you're kind of seeing how it's affecting you the next day, I find that to be extremely helpful. You agree?
It does, because you see the good and the bad things you ate yesterday, and then you see how it affects you today. I also found out myself, there's a lot of apps and things on your phones that track what you eat. And I did that for a little while, and I wanted to lose a little bit of weight, and it helped me do that. But then it also taught me that if you wanted to eat a little bit more, if you exercise a little bit more, it gave you a little bit of leeway that way to keep you at that same caloric intake given the amount of diet and exercise, so it evened it out. One night I wanted a couple more pieces of pizza. I went out for a quick walk, came back, and I got my pieces of pizza.
Perfect.
It works.
And I try to tell people too, just because there are a lot of good foods out there that might not just be good for your body type.
Right.
So I think you kind of have to weigh them. Like, for example, I found out I love popcorn. And if it's air popped, it's great for you, right?
Right.
I have an allergy, so it didn't work out too well for me.
Yeah. Well, I tell people, pay attention. Some people lose weight by cutting carbs. Some people lose weight by cutting fats. I can't touch a fat. My wife can't touch a carb. Everybody's a little bit different.
Yep, find what works for you. Red wine and white wine. And I do, I would say if you're going to drink, do you agree wine's better than drinking alcohol, or is a clear alcohol same thing?
It's the whole European diet concept. They say Europeans have a glass of wine frequently with dinner, and they're much healthier. And they're thinking more red wine than anything else. So yes, there's just a lot of calories in alcohol to begin with. So if you tend towards the wine that's supposed to be healthier for you, the only problem is I know a lot of women, red wine is a trigger for hot flashes.
That's kind of where I was going. It is, correct?
100%.
Why? More so than not so much as the
I don't know
white?
if it's the tyramine or the tannins that's in there, it causes them to flash. It's a trigger right away.
Okay. I thank you so very much for being with us. It's very, very, very informative.
Thank you, Mary.
Thank you, and I hope you'll come back and join us for another show in the future.
Anytime, I'd be glad to.
All right, thank you so much for watching. I'm Mary Pipino, Dr. Dean Economus, and if you have questions for Dean, can we call your office?
Sure, anytime.
Questions you can send to info@thefitness.com, and we will get them to Doctor. But if you would like to, talk to Doctor about something or schedule an appointment,
330-884-2400.
And you are located
at Southwoods Commons.
Thank you again. I'm Mary Pipino, and this is Fit for You.